My name is Guillermina Rojas. My presentation is about screening for mental health issues with a special population. Older adults. Mental conditions among older adults include dementia, affective disorder, isolation, psychosis, and anxiety disorder, to mention a few. The World Health Organization explains that most older adults experience cognitive deterioration, behavior, and belief disorder, and confusion from physical condition or surgery. Assessment and screening. The DSM-5 facilitates a concise and explicit mental disorder diagnosis, enabling an objective assessment of symptom presentation. The DSM-5 depression assessment requires an individual to experience a minimum of 5 symptoms in 2 weeks, with at least one or more being a lack of interest or depressed mood. Other symptoms include hopelessness, anxiety, irritability, fatigue, suicidal ideation, sleep and eating irregularity, and memory and concentration problems. Depression among older adults is treatable through various interventions, including pharmacological. Pharmacotherapy includes medication that balance mood-affecting hormones such as serotonin. Psychotherapy includes counseling and talk therapy and allow older adults recognize and change troubling behavior, emotion, and thought. Perinatal. Mental health conditions are highly prevalent in perinatal patients. The prevalence of mental health disorders during pregnancy is 25.3% and 27.5% in postpartum women. Depression and anxiety are high both in the antenatal and postpartum population. Although depression and anxiety are prevalent in antenatal and postpartum mothers, other conditions may also present, including psychosis, panic disorder, PTSD, and obsessive compulsive disorder. Assessment and screening. Screening involves psychometric scales. Screening tools include Patient Health Questionnaire 9, Postnatal Depression Scale. A short screening includes Woolley question. Symptoms assessed psychometric scales include mood, reactivity, panic, sleeping problems, sadness, and anxiety. According to Howard and Califett, the most prevalent psychological treatment for perinatal mental disorder include cognitive behavioral therapy, interpersonal therapy, exercise, listening, visits. This intervention includes therapy sections or visit sections. Pharmacological treatment include antidepressants, which are appropriate monotherapy for depression. Adolescents. The World Health Organization reports that the global prevalence of mental problems among children aged 10 to 19 years is 14%, an equivalent of 1 in every 7 adolescents. In the United States, 49.5% of adolescents between 13 and 18 have at least one mental health disorder. This population's most prevalent mental conditions are anxiety, depression, and behavior disorders, which contribute to disease and disability. Suicide rates fall among the chief causes of death among adolescents 15 years old and above. Screening tools align with the International Classification of Diseases 10th revision, ICD-10, a DSM standard for diagnostic prediction. Mango explained that the General Health Questionnaire 12 is an effective screening tool involving a self-administration questionnaire for common mental disorder. The General Health Questionnaire 12 contains 12 questions and identifies non-psychotic mental illness such as depression, anxiety, and psychological distress. The treatment plan for mental health problems among adolescents depends on diagnosis and symptoms. Some commonly used interventions among adolescents with mental disorder include cognitive behavioral therapy, e-therapy, family therapy, and anger management. These interventions focus on adolescent behaviors and thinking style and treat problems such as substance abuse, anxiety, eating disorders, depression, overwhelming anger, and low self-esteem, to mention a few. Interpersonal therapy addresses social interaction experience by focusing on communication and interaction. Pharmacological treatment include antidepressants such as fluoxetine and escitalopram, antipsychotic medication, and mood stabilizers such as lithium. LGBTQ Population Overview. People who identify as LGBTQ are marginalized in society and typically experience numerous stressors as a minority group. The most prevalent mental health disorder among LGBTQ individuals include depression, substance abuse, self-harm, and suicidal ideation, compared to the general population. Mental health disorders arise from discrimination, social isolation, prejudice, rejection, homophobia, hate crime, and coming out challenges. Assessment screening. The DSM include a diagnosis of LGBTQ health problem, refugee health screening, the 4-item NIH toolbox, loneliness, patient-reported outcome measurement information system, outness inventory scale, Beck depression inventory, Montgomery-Åsberg depression rating scale, clinical global impressions. Mental health disorders among LGBTQ individuals are risk factors for numerous health issues such as sexually transmitted diseases, including HIV. Treatment plan. Psychotherapy such as cognitive behavioral therapy, family therapy, LGBTQ affirming, effective skills to empower effective men, empowering queer identity in psychotherapy, among others. Immigrants. Population overview. In 2019, immigrants in the U.S. comprised 14% of the population, amounting to 44.9 million people. Immigrants, including first and second generation, experience mental health disorders including ADHD, anxiety, PTSD, depression, trauma-related, and bipolar disorder. Mental health problems among this population typically result from exposure to a stress factor before, during, and after migration, integration, and settlement. Assessment screening. Screening allows timely referral. Some standard assessment screening tools: Refugee Health Screener 15, Minnesota Awareness and Emotion Check, Harvard Trauma Questionnaire, Primary Care PTSD Screen for DSM-5, PTSD Checklist for DSM-5, Patient Health Questionnaire PHQ-2 and PHQ-9, Hopkins Symptom Checklist 25, and CAGE Questionnaire. Immigrants lack mental health access and suffer care continuity disruption. Intervention should account for language and cultural factors and align with national mental health policy and guidelines. Treatment plan. Interventions such as trauma-focused cognitive behavioral therapy, prolonged exposure, narrative exposure therapy, group therapy, and eyes movement desensitization, and reprocessing. Help to treat depression, anxiety, and PTSD among immigrants. The narrative exposure therapy is effective in low-income and post-conflict situations and integrate testimony therapy and cognitive behavioral therapy to target immigrants with past experience of numerous traumatic events through their life. Pharmacological intervention include psychotropic medicine such as antidepressant, antipsychotic, hypnotic, and anxiolytic. Thank you for your time.